But rewiring the brain isn't instant, it's intentional. It takes effort, patience, and practice. Whether you're trying to overcome a fear, build a new skill, or heal from past trauma, the process begins with consistent, conscious choices. Every time you challenge a limiting belief, push through resistance, or choose growth over comfort, you're literally reshaping your brain's architecture. The more you repeat a thought or behavior, the stronger that neural pathway becomes. It's like building a mental highway at first. It's rough and uncertain. But with repetition, it becomes a clear route your brain can travel more easily. And the best part? Age doesn't disqualify you. Neuroplasticity exists in children, yes, but also in adults, elders, and even those recovering from neurological damage. The ability to change isn't a privilege of youth, it's a gift we carry with us, quietly waiting to be claimed. That means it's never too late to think differently, learn something new, or redefine who you are. Your brain is listening, it's adapting. And with every choice you make, you are quite literally becoming a new version of yourself. Just like the body needs movement and nourishment to thrive, the brain craves rhythm, rest, and mental clarity to perform at its peak. We often romanticize hustle culture late nights, constant stimulation, endless multitasking, but that lifestyle comes at a cost. The brain is not designed to run on fumes. It needs quality sleep to process information, organize memories, and reset emotionally. It needs silence to recharge. It needs boundaries to filter out the chaos of overstimulation. Without these basic forms of care, even the sharpest mind becomes foggy, reactive, and eventually burned out. Mental fitness, like physical fitness, is not about intensity, it's about consistency. Feeding the brain with positive, high-quality input is just as important as removing what drains it. What you read, listen to, watch, and talk about these things shape your neural environment. You can't expect mental clarity if your daily diet is negativity, gossip, and overstimulation. Practices like mindfulness, journaling, meditation, or even 10 minutes of conscious breathing can dramatically improve cognitive flexibility, focus, and emotional regulation. These aren't luxury rituals, they're brain hygiene. And the best part is, they're accessible to anyone, anywhere, regardless of age, background, or lifestyle. Just as important are the emotional habits we cultivate. Gratitude strengthens resilience. Curiosity fosters creativity. Compassion builds emotional intelligence. Even laughter activates areas of the brain that boost mood, reduce stress, and improve problem solving. Mental habits aren't just about what we avoid, they're also about what we create. When we prioritize peace, purpose, and presence, we give the brain space to do what it does best, adapt, grow, and lead us toward our highest potential. When your mind is in harmony with your purpose, your brain becomes more than an organ, it becomes a compass. It starts recognizing opportunity where others see obstacles. It begins to craft creative solutions before problems even arise. And that's not luck, or magic, or mystery. That's the power of a trained, focused, and self-aware brain working with you, not against you. Alignment doesn't mean perfection. It means clarity. It means that your thoughts, emotions, and intentions are all pointed in the same direction, creating momentum that's both intuitive and unstoppable. Too often, we chase productivity without presence. We hustle harder without asking if we're headed where we truly want to go. But when the brain is aligned with your inner vision, your energy becomes smarter, not just louder. You start to notice patterns, connect dots, and move with more conviction. Distractions lose their power. Comparisons fade. You no longer rely solely on motivation. You move from conviction. The brain, once trained in this way, becomes a partner in your progress. It supports your growth, guides your instincts, and builds your confidence from the inside out. So, the next time you doubt yourself, pause and remember the power that already lives within you. You don't need to have it all figured out. You just need to start listening to your brain, trusting its process, and treating it like the extraordinary force it is. Because this isn't just about neuroscience. This is about owning your potential, reclaiming your narrative, and realizing that your greatest asset has always been with you wired for growth, resilience, and brilliance. The world doesn't need a perfect version of you. It needs the most aware version of you. So align, evolve, and let your brain lead the way. The rest, you're more than capable of figuring it out. Thank you. Location. You have 2 kidneys located on either side of your spine, just below the rib cage. They are retroperitoneal, meaning they lie behind the peritoneum, the lining of the abdominal cavity. External structure. Renal capsule, thin, tough outer membrane that protects the kidney. Renal cortex. Outer region beneath the capsule contains nephrons, the filtering units. Renal medulla, in a region composed of cone-shaped structures called renal pyramids. Renal columns, extensions of cortical tissue between pyramids. Renal pelvis, funnel-shaped cavity that collects urine from the pyramids and channels it into the ureter. Internal structures, nephrons, functional units. Each kidney contains about 1 million nephrons. Main parts, glomerulus, ball of capillaries for blood filtration. Bowman's capsule surrounds the glomerulus. Proximal convoluted tubule, reabsorbs nutrients, water. Loop of Henle, concentrates urine. Distal convoluted tubule, regulates ions and pH. Collecting duct, final site of water reabsorption, leads to the renal pelvis. Calyces, minor calyces collect urine from the pyramids. Major calyces form from minor calyces and drain into the renal pelvis. Blood supply. Renal artery brings oxygenated blood into the kidney. Renal vein carries filtered blood away from the kidney. Rich capillary network surrounds the nephrons for filtration and exchange. Filtration occurs in the glomerulus, part of the nephron. Blood pressure forces plasma minus large proteins and blood cells into the Bowman's capsule, forming filtrate. This is the first step in urine formation. Reabsorption happens mostly in the proximal convoluted tubule and continues through the loop of Henle, distal tubule, and collecting duct. Essential substances like water, glucose, amino acids, ions, Na, Cl, K, HCO are reabsorbed back into the peritubular capillaries. Secretion, active transport of substances from blood into the tubular fluid. Happens mainly in the distal tubule and collecting duct. Removes hydrogen ions, H, acid-base balance, potassium ions, K, drugs and toxins. Excretion. The final product, urine, contains waste, excess salts, and water. It passes from collecting ducts, renal pelvis, ureter, bladder, urethra, water, and electrolyte balance. Controlled via antidiuretic hormone, ADH, and aldosterone. ADH increases water reabsorption in the collecting ducts. Hormonal functions, erythropoietin, EPO, stimulates red blood cell production. Renin, part of the RAS system, renin, angiotensin, aldosterone system, regulates blood pressure. Calcitriol, active form of vitamin D, helps regulate calcium levels. Aldosterone increases Na, reabsorption, and K, excretion. Water and electrolyte balance. Controlled via antidiuretic hormone, ADH, and aldosterone. Acid-base balance. Kidneys regulate blood pH by reabsorbing bicarbonate, HCO, secreting hydrogen ions, H,